Right, so you've got your kind of exercise plan, and I think you've got a good understanding of now how you've got to where you are and what we need to do to get better. But quite often it can be good to just see that sort of journey and know what we can address going forward. So it's about 4 years ago, wasn't it, that you dropped that piece of equipment and got that kind of low back pain, right?
Yeah.
So that was your kind of low back pain. Now usually that would take kind of 3 months to get better when you strained a muscle or a bit of tissue. But after 3 months, we changed the way we moved and started to kind of avoid some of the movements and stiffen up, and no one told us it was safe to move. So, and movement, we started to avoid, yeah?
Mm-hmm.
And that, as we've kind of explained, can increase our pain. And then once that starts to happen, we start to get a bit kind of stressed or worried that something serious is going on. And what does stress and worry do? What were the 3 things? What do you remember what it did to your heart rate?
Increases heart rate.
Yeah. And muscles?
Increases muscle tension.
Muscle tension. And then it also releases, you remember that chemical we talked about?
Adrenaline.
Yeah, that's right, adrenaline and that. All of those things, remember they sensitize the system, so that can really wind our pain up. And with that sensitized system, what happens to our sleep? Does it increase or does it decrease?
Decrease.
So sleep decreases, and when you kind of haven't slept for a while, again, you become quite aware and sensitized. You feel yourself, knocking into things, so that can increase our pain. So now we're not sleeping, we're stressed and worried. So what happens to our exercise levels? Do they go up or do they go down at this point?
Go down.
So our exercise levels go down, and then we stop producing our kind of happy chemicals, so we get less happy chemicals. So what's that likely to do to our pain?
Make it worse.
Yeah. So we've got that feeding into our pain, so our exercise level. So then we're now releasing the happy chemicals. What do you think that does to our mood? Up or down? Better mood, less mood, or lower mood? Lower mood. Perfect. So our mood, what's that going to do?
Make our pain worse.
Yeah. So then, at this point, you're kind of going, well, now I'm not sleeping, I'm stressed and worried, so I can get all sorts of things going off from that. You mentioned you have a bit of a dodgy tummy. It's because all the blood's been diverted away from our guts, because it's trying to fuel our muscles. You start to kind of then reduce your participation with your friends, your family, your children, so we get less kind of emotional support, right?
Mm-hmm.
And what's that going to do to our pain? Make it better or make it worse?
Make it worse.
Yeah. And then you're kind of going, which is now 2020. Do you understand how you've got here?
Yeah, no,
Does that make sense to you?
It does make sense. It makes a lot of sense.
Right,
Yeah.
so what are the things here that we can address? What things would you tick off now that we can do?
Well, I know how to kind of move in a more relaxed way now.
Perfect. So we can reduce our pain by increasing our movement.
Yeah.
Brilliant. So we can cross that one off our list. What about your stress? Do you feel more relaxed about what's going on? Know what to do? Do you feel more in control?
Yes, no, I do feel more in control. Yeah,
And you're able to lower your heart rate.
Yeah.
You're able to reduce your muscle tension.
Yeah.
And that has a knock-on effect with the stress of reducing our adrenaline. So we're going to start to reduce that method. Yeah?
Yeah.
And that should have a knock-on effect on this. Yeah?
Yeah.
And you've got an exercise plan, so we are now, what are we doing? We're increasing our exercise level.
Exercise, yeah.
Look how many things we're ticking off there. Fantastic. And all that has got to have an effect on this, hasn't it? Do you feel a bit
Absolutely.
happier and more in control now?
Yeah, definitely.
So that's also going to reduce the sensitivity of our pain. So do you feel a little bit more confident about putting your children in the bath, or at least trying to attempt it?
Yeah, I do.
And that's going to make you feel a bit happier, right?
Absolutely.
And then 2021, very good year for you.
Great stuff. Thank you.